Are you going for a total hip or total knee? In other words, are you going for some orthopedic surgery? If you are, please listen on. Years ago, when patients would ask me, hey doc, what should come first? The vein procedure that you told me I need, or should I get my hip or knee done? I would simply ask them, what hurts more? Then some research came out which changed what I tell patients dramatically. Now, when a patient comes to see me that has surgery scheduled for a new knee, a new hip, I tell them get the veins treated first, because multiple research studies have shown that treating the underlying vein condition called venous insufficiency decreases the risk of a blood clot after these orthopedic surgeries. Not only that, but for knee surgery, one of the big potential complications afterwards is knee swelling, leg swelling. If we address a patient's knee swelling and leg swelling by treating their underlying veins, that's only going to make the post-operative healing much easier. Don't forget, if you are suffering from any of the following leg symptoms, heaviness, aching, swelling, throbbing, itching, give us a call. Obviously, if you have varicose veins or spider veins, give us a call. We'll take good care of you. Thanks for watching. We'll see you in the next one.